When we say charge on, we commit to do extraordinary things. It's a catalyst for action. To put in the work. To keep trying. It's a challenge. To be smarter and stronger. Charge on. It drives us to be more. To get after it every day. It's time to rise above. To let them know we're coming. Charge on. Charge on.
Hello, everyone. Welcome to the Research Recovery and Reskill webinar. This is our second webinar of the fall series. Thank you for making time in your busy schedules to be with us. I'm Susan Vernon-Devlin, Manager of Communications and Marketing here at Rosen College of Hospitality Management, and I will be your moderator for the webinars. Today, our topic of discussion is part one of a four-part mini workshop series called People Working or Not Working in Isolation, Coping Tools for the Hospitality Industry. These four workshops are in collaboration with the UCF Department of Psychology and will be presented by world-class researchers outside of the hospitality industry. Before we get started, first a bit of housekeeping. Attendees, we will use the question and answer feature during this webinar. So if you have comments and questions, please place them there and we will respond to them at the end of the presentation. If your question is the same or similar to another question that has already been asked, we will only answer the question once. If we don't get to your question at the end of the presentation, rest assured we will try and contact you afterwards to respond. And now, without further ado, I would like to introduce Dr. Kristen Horan, an assistant professor in the Industrial Organizational Psychology program at the University of Central Florida. Dr. Horan is the Deputy Director of Program Administration for the Targeted Research Training Program. In this role, she organizes and evaluates each semester's Targeted Research Training Program workshop. Dr. Horan will provide a brief overview of the Targeted Research Training Program and introduce today's speaker. Dr. Horan?
Thank you so much, Susan. I want to take a moment to welcome you, the audience. We have audience members from very different walks of life joining us today on the webinar series. Some of you may be current UCF students, eager to learn more about the industry during this time. Some of you may be UCF alumni who still maintain that connection with Rosen College of Hospitality Management. Some of you may be currently working in the industry and feeling the struggle of the current context. And some of you may be researchers with an interest in the health and safety of the hospitality workforce. Whatever your role is and whatever your reason is for joining today's webinar, we want to thank you for your interest in fostering the health and safety of today's hospitality workforce. The drive to promote the health, safety, and well-being of the hospitality workforce is not new to the Targeted Research Training Program. In fact, it guides all of our activities, including this webinar series. The Targeted Research Training Program, or TRT for short, is housed in the Department of Psychology at UCF. We perform cutting-edge research on how to improve the workplace health and safety of employees within the hospitality industry. We provide graduate level training in interdisciplinary research experiences so that we can really build up the next generation of occupational safety and health professionals. And finally, we perform outreach and dissemination services of our research findings, such as this webinar series, so that we can get current expert knowledge out into the industry where it can help make actual improvements. We are part of a larger program called the Sunshine Education and Research Center. This is a center housed at the University of South Florida, and it's funded by the National Institute for Occupational Safety and Health, or NIOSH for short. I'd like to direct your attention to the grant funding statement at the bottom of the screen on that note and point out that the content covered in this webinar represents the feelings of the authors and the presenters and does not necessarily represent the views of NIOSH or the CDC or the Department of Health and Human Services. The work of targeted research training, whether it be research, graduate training, or outreach, is performed by 5 core program faculty who represent the Industrial Organizational Psychology program at the University of Central Florida and the Rosen College of Hospitality Management. We also perform research with our academic partners who represent faculty and graduate and undergraduate students from multiple disciplines and multiple universities. That's one of the reasons that we're so excited about this particular targeted research training program, is because we believe that to develop comprehensive solutions to the workplace health and safety issues facing the hospitality workforce today, it can't just be done by one program or one discipline. It's truly a collaborative effort. And finally, we want to thank our advisory partners who guide all of our research and outreach efforts, including our partnering hotels in Central Florida, union representation, and experts in research and public policy. I'd like to take a moment to introduce our speaker today, Dr. Deborah Beidel. She's a trustee chair and Pegasus professor in the clinical psychology program at the University of Central Florida, as well as the executive director of UCF Restores. And I'm going to take a moment to pull up her her introduction. My slide share was taking up my whole screen. All right, so Dr. Deborah Beidel received her PhD in clinical psychology from the University of Pittsburgh and completed a postdoctoral fellowship in clinical research at the Western Psychiatric Institute and Clinic. Dr. Beidel holds diplomas in clinical psychology and behavioral psychology from the American Board of Professional Psychology. She is the author of over 300 scientific publications, including journal articles, book chapters, and books on the treatment of anxiety disorders and post-traumatic stress disorder. Dr. Beidel is the executive director of UCF Restores, a clinical research center dedicated to changing the way we understand, diagnose, and treat post-traumatic stress disorder. She's been the recipient of over $31 million in federal research funding throughout her career. Her recent clinical research focuses on developing effective treatments for trauma for veterans, active duty military personnel, first responders, and survivors of mass shooting by utilizing technology such as virtual reality to enhance effective treatments and then disseminate those treatments into standard clinical practice. I'm very pleased to turn the presentation over to Dr. Beidel, who will speak on the mental health strategies that can be useful in dealing with isolation.
Good afternoon, everyone. It's really nice to join you here today and to talk a little bit about mental health and during these times of social isolation. I think to start off, I want to talk about trauma, because I think this is a word that we sometimes in our lay vocabulary use quite often. And we don't always use it in the same way that we use it in mental health and in psychology. So I want to talk about what we talk about as trauma, and that is that it's an event that involves actual or threatened death or serious injury or threat to one's physical integrity. So we really think about it primarily in terms of life and death actions that may occur. And there are different types of events that may be considered trauma or lead to some type of trauma disorder. And those include, as you can see on the slide, natural disasters, terroristic events, physical or sexual assault, motor vehicle accidents, and combat trauma as well. The interesting thing is that when you survey the American population, up to 90% of Americans have exposure to a traumatic event at some time during their lifetime. That's a significantly high number, but just because people have a traumatic event doesn't necessarily mean that they develop post-traumatic stress disorder. If I could have the next slide. When we're talking about the typical reactions to trauma, I really think I want to call your attention to these different lines that you can see on the right-hand side, because this chart was some work by George Bonanno and his colleagues out of New York, have really provided us with a roadmap to how we think about traumatic events. And that is, if we look at the line on the bottom, we're talking about a group of people who seem to be pretty resilient in the face of these different types of traumatic events. They may have some mild symptoms when the event occurs, and then you'll see that they decrease and they have pretty much go back to their normal functioning. A second group that's important to consider are the people that we call the recovery group. So that long dashed line there in the middle. They may start out with some moderate degree of symptoms, and then over a period of time through the natural recovery process, after about a year are then functioning pretty well, and then in the second year really get back to what was probably their original level of functioning. The two groups that we as mental health professionals and psychologists are really concerned about are the individuals who are in either that delayed group where they have moderate symptoms and then over time, instead of having recovery, actually have symptom increases. And then finally, that group at the top that really has sort of a chronic disorder. From the very beginning, as soon as the event occurs, they have a severe reaction, and even across the course of a 2-year period, maintain those very high symptoms. Next slide, please. Another thing to keep in mind is that the speed of recovery by these traumatic events really differs depending on the type of event that has occurred. So whether it can be some kind of war-related trauma or physical violence, sexual violence, accidents, other types of trauma such as natural events, we really do see some different patterns of recovery. And this is important for us because we really want to provide services and care to the people who need it and not to the people who are going to recover in a normal fashion. Now, of course, there are times when we need to intervene when we start to hear suicidal ideation or suicidal acts, or there's a real breakdown in functioning. But in general, we often wait till a month or two after the traumatic event occurs before we begin to speak about recovery to any individual. The next slide, please. So a question that I get asked a lot recently is so what about COVID-19? You know, what kind of event is this? And if you look on the left, you can see what we're talking about, how this event really is different in some ways from the other types of traumatic events that we experience in our lifetime. It's different because we don't know how long it's going to last, right? We know if a hurricane comes, we know that's going to occur at a certain time. We know it's going to be over at a certain time. When I first moved to Florida, the first thing I heard was the first 72 are on you. You know, after a hurricane, you have to be able to take care of yourself for 72 hours. But we have these predictors. We don't have that with this pandemic. We don't know when the end is going to come. Another way that it's different is that we have had a severe shortage of resources that we need. So people who needed to be able to go out and take care of us during these events, things were worse because we had a shortage of the supplies that we needed, and that creates additional stress. And again, that usually doesn't happen during regular or other types of traumatic events. If there's a problem and there's a hurricane in Florida, you know, people from Buffalo, New York will come down if they know how to put the electricity back on, and they'll help. In this pandemic, people haven't really always, particularly in the beginning, been able to provide enough support. Also, it's this imposition of these public health measures. And I'm not going to get into, should we wear a mask? Should we not wear a mask? I'm just saying that what's a little bit different is that we've got these public health directives that are supposed to be directing our behavior. And again, that's a little bit different than in some of the other types of traumatic events that occur. Severe economic losses, again, across the country, across the globe. These are circumscribed in many cases. In many cases, in other traumatic events, we don't really have the entire country being affected by something like this. And then again, conflicting messages from authorities about how long this is going to last, what we should do about it. So those can create a much higher level of stress and distress than if those events and those factors were not occurring. COVID is similar to other traumatic events in that it also affects individuals. At Restores, we say that we are about restoring lives, families, and communities. And like other traumatic events, COVID-19 is affecting our community. In this case, our community being our country. But even within that, the different levels of COVID that occur in different places have produced differential impacts. Like other events, other traumatic events, we have this range of emotional responses. So one thing I tell people about a traumatic event is not everyone is going to be affected by that event. And it should never be assumed that no one is going to be affected by that event. Reactions to trauma are very individual, and we expect all types of reactions, including no reaction at all. These types of stressors, with prolonged stressors, we know that they lead to very unhealthy behaviors. So, you know, they lead to things like drinking too much, they lead to things like sleeping too much or not being able to get to sleep. And they also lead to non-compliance with health directives because people are tired. And so because this has gone on so long, people are tired. We see that in Florida with the governor opening things up, saying people want to get back to normal. Again, as I said, some people are more vulnerable than others, and we have to think about that when we think about what it is that we're going to do and how we're going to approach this from a mental health perspective. The next slide, please. I want to talk for a few minutes about groups that are really at much higher risk for the stress from COVID-19. Some we think about and some we might not think about. First, our first responders. And in thinking about our first responders, you know, we know that many of them, there's been a number of first responders who have died as a result of exposure to COVID-19. And one of the reasons is that, you know, they're the ones, the fire department, EMS, people are cross-trained anymore, they do both jobs. And then what happens is they have to go out to places, they're the ones that pick up the severely ill and take them to the hospital. So we have people who are in very close contact. What happens then with our first responders is that if they are in contact, then they must isolate. They have to isolate both from their families and from their jobs. So they're in a hotel by themselves for 10 to 14 days, unable to interact, unable to do their job. This creates a lot of stress. It creates a lot of stress on the family. It also creates a lot of stress on the occupation because somebody else has to pick up the slack. If you're in isolation, you can't go to work and affect everyone else. So what happens is everyone else has to take extra shifts, creating a lot of additional stress. Our medical workers, I think we've talked about quite a bit. I think the one thing that we have to keep in mind is that we have had medical workers as well who have committed suicide as a result of this pandemic. And I won't ever forget the words of one Florida respiratory therapist who said that, you know, he couldn't take it anymore. The sound of trying to push air into lungs that were like cement just was the final straw for him. That sound was haunting him over and over again, to the point where he thought that his only choice was to commit suicide. So it's not just the long hours, it's the being around death all the time, the continuing not being able to do something. Thank goodness now we have better treatments than we did at the beginning of this. I've put teachers in there because I think this is another group that we don't think about sometimes, and the fact that all of us who have children know that, you know, they go to school and bring everything home, and so interacting with them all day puts people at higher risk, and I think the stress from that is something that we don't often consider when we're thinking about the people who are affected. I put patients down in the left-hand corner talking to someone over an iPad, because I think this is, again, something that affects our medical personnel as well as the patients. This whole idea of having to say goodbye to your loved ones over an iPad, and that final moment of intimacy where you want to be with someone that you love and you can't, and there's a stranger who is witnessing those final last goodbyes. The funerals, I think, are another group of people. Anyone who has lost someone knows that funerals are there for the living, the ones that are left behind. And there are so many people now who have been deprived of that opportunity to have a funeral, to get hugs from family members and friends, and who, quite frankly, are just haunted by the fact that they could not be in the room with their loved ones, and then that they could not also be able to have what they consider to be a proper funeral. Next slide, please. So stress, let's talk for a minute about stress. You know, stress comes from how you interpret or think about an event. An event by itself is not stressful. It's not a particular physical thing that happens. It's the meaning that we all interpret to that particular event that can lead to stress. Just having a conversation the other night with a colleague, she said to me, "Oh, by the way, I'm getting a divorce." The first words out of my mouth were, "Oh, I'm sorry." She said, "Oh, no, it's a good thing. We both think it's a really good thing." So again, something that I immediately interpreted as something that was stressful for her, it was fine with her. They were all good with it. So again, it's not the event, it's how we interpret it. And these reactions are really unique. It happens to be the person that is experiencing it. So what is stressful for you will not necessarily be stressful for someone you supervise or a coworker. It goes vice versa as well. So you may be stressed out and other people may not understand why that's important to you. It has to do with your background, other types of events that have occurred to you in the past, even your economic status sometimes. We know that people after a hurricane who are most affected by stress and have the negative effects are people who work for an hourly wage, who have to go to a certain place to check in and do their job, and then the building isn't there anymore, or it isn't functioning. Whereas those who are salaried workers or who can work from home, there's still stress. I'm not saying there's not, but it's a different kind of stress because they don't necessarily lose their economic income because the building has been flattened. Next slide, please. So I want to talk about the anatomy of stress. And if you could click for me, Kristen, these will, I think, come up once at a time. When we're under stress, our senses and perceptions really sharpen and time starts to really slow down for us. So next click, please. Our body sweats, and the reason that we sweat is that it helps us keep cool during exertion. It also, if you're in a fight, makes you harder to grab. You're slippery, and so therefore this kind of stress reaction can help you get away from something that may be trying to get you into a hug or pin you to the ground. Next part, please. Your hormones are released and your blood gets stickier so that you will bleed less during these times of stressful events. Next, there. Your digestion stops. It's diverted away to other parts of your body because it goes to your arms and legs. It's what we call the fight or flight response. Next part, please. Blood flows to your muscles, makes them tense, ready for action. For those of you who are old enough to remember the Incredible Hulk, sort of what happened when he changed from the mild-mannered scientist to the Incredible Hulk. Next part, please. Your heart beats faster, your blood pressure increases, it prepares you for peak exertion. Next part. You breathe more rapidly. You're oxygenating your blood, again, for this fight or flight response. Next part. And then finally, in times of very high stress, you can actually urinate or empty your bowels. It's actually the body's way of making you lighter so you can run faster. These things don't happen to us automatically. And if you think about it though, over a period of time when that stressor stays there and your body is reacting to the stress, we get to the point where you actually get to exhaustion. Your body is no longer able to keep up this fight or flight response, and there's this crashing that occurs where you're just then unable to do anything. Next slide, please. So how do you manage stress? I mean, I think we have certain platitudes that we talk about when we manage stress, and managing stress requires, first of all, that you recognize that you're experiencing it. And that's not always easy for a lot of people. At Restores, we work for a lot of people who don't even think they're stressed when their muscles are very rigid, their jaws are clenched, they have high blood pressure. So the first thing is to recognize that yes, indeed, you are stressed, not to deny it, but to just accept the fact that this is part of being a human being, and that therefore it's going to happen to all of us. And then the second part is called what we're practicing self-care. And self-care can take many different forms. If we could have the next slide, please. So, you know, in normal non-COVID times, these are what we call general self-care techniques that you can use to manage stress. And hopefully there'll be a day that comes when we can get back to using all of these typical responses and self-care for stress. But if you look at this list, one of the things that becomes quite evident is that we can't do some of these things in this time of COVID. So spending recreational time with others, maybe if we're outdoors, exercising regularly, maybe if the gyms are open and we wear a mask, and that's kind of hard to do if you're running on a treadmill, engaging in hobbies and recreational activities, taking vacations, maybe if you're willing to get on a plane, and if the planes are going to the places where you want to go, building significant relationships, contributing to causes. I mean, for those of you who are involved in political activities, you know that there's not a lot of door knocking going on right now. There's other ways that people are trying to communicate. So it's different in this time, but these are just some of the ones that we might want to look at. So if we can have the next slide. So what do we do during this time? Some of the challenges that COVID has brought for all of us, working from home and changing your schedule. I don't know about all of you, but I seem to spend more time in my home office than I did in my office at UCF. When I was, since I've been working at home. So the hours have gotten longer. Balancing personal and family issues. So it's been very interesting. Before we started this, I was telling the other panelists that the one thing I had to do anymore before I started something like this was go take care of my dog, so that we could take care of everything and wouldn't have barking, or she wouldn't have to go out. So all of these things, I mean, think about people who have small children. You know, my nephew, who is trying to do his job and at the same time help his little first grader on her Zoom classes. You know, she's not old enough to do these things by herself, but this sort of balancing these personal and family issues with working. Social isolation, and this is the one we're going to talk about a little bit today. So let me do the other two and then I'll get back to this. So, you know, not having the tools and equipment needed to perform your job. We've just gotten some money from the Orange County CARES funding, because we're going to be working with people in Azalea Park who you know, not necessarily have the resources to be able to perform their job from home. They don't have enough computers for the whole family. They don't have strong enough internet. So we're going to be helping to reduce their stress by providing some types of different resources that they might be able to use. And we talked about inability to participate in certain recreational activities, but this social isolation is the one that I think is critical. You've identified it, we've identified it, in that limited contact. I tell the story. I have a friend who is in Milan, in Italy. And she was in the middle of the worst part of COVID back in the earlier part of the year. And although she's a psychiatrist, she posted a picture of herself on Facebook in scrubs. And I sent her a message saying, "What are you doing wearing scrubs?" She said, we're all wearing scrubs. We're all helping out with this. And I said, "Well, what can I do for you?" And she said, "Will you just send me a little message every day? Every day, just send me a little note so that I know that someone out there is thinking about me." And that social connection is so critical for what we do. So I sent her stupid things, pictures of my dog, a song I heard, but just to keep that social connection there, because she certainly was socially isolated, having to stay in that hospital for all those times to work with all the people who had developed COVID. Next slide, please. So again, what can we do? Well, keeping contact with others is critically important. And although, staying at home is not the best thing in the world for most of us, thank goodness that we do have electronic capabilities that 20 years ago we might not have had, or we'd be talking about a whole different level of social connection. But it is important to keep in contact with others. And I don't mean just go to all your Zoom meetings, which exhaust us by the end of the day, but to just keep in touch with the people who are important to you. And for every one of us, like our reactions to trauma, it's going to make us different. Some of us are going to want to have connections with lots and lots of people. Others of us are going to want to have connections with just a few close friends. We each have to do what works for us. So, how do you feel connected? Some people set up specific times. So I have some friends with whom we have a little cocktail hour over Zoom, or we have lunch over Zoom. So we set up a specific time. Other people I connect with, just sending them a text, "How you doing today?" Something on Facebook, whatever way is the way that you connect with other people. And sometimes you can choose the people that you know, but sometimes reaching out or getting something from someone that you haven't talked with or talked to in a while is really important. So connecting with people with whom you may have lost contact, and just, again, we're not talking about long conversation, just, "Hey, you were on my mind today, wanted to send you a note, see how you're doing." So do what works for you. This is critically important. I can't say this enough. What we know in this time of COVID is that everybody's stress has gone up. Thoughts about suicide have gone up. And one of the things that we know for a fact is that one of the factors that keeps people from carrying out a suicidal plan is knowing that there is someone else out there that cares. It doesn't stop all of them, but it stops a great deal, because it breaks that connection, and it's the idea, "Hey, I'm reaching out to you, I'm thinking about you." You may not know that they are contemplating suicide, but your single line may turn out to be their lifeline. That may be the thing that pulls them back from the edge, and you may never know it, but it's important to do it just because you might never know. So we also know that feeling isolated leads to, as I said, increased depression, anger, anxiety, sleep problems, and substance use. So social isolation is a situation, right? I said before, the stress is not the situation. So the fact that we are all somewhat more isolated is a situation. How we interpret that and how we react to that is how we manage that situation. So in the next few slides, I want to talk about some of the common reactions and what we can do to deal with our responses to social isolation. This is, again, a list of some of the reactions that people can have on the left to being isolated during this time of COVID-19. Look at those figures on the right. These are brand new data from late June. 40% of US adults report struggling with mental health or substance use. surveys that we do the general population in non-COVID times, when we're talking about the prevalence of mental health disorders in the general population among US adults, we're talking about 20% of the population. We've doubled it by the end of June of people who are reporting stress and anxiety symptoms. Look at the ones on the right. Those are the ones that I'm really getting more concerned about. The number of people who have started or increased their substance use as a way to deal with the emotions that have come about as a result of this situation that we're all in. And also 11% seriously considering suicide. That's high, okay? So we've got to learn how to take care of ourselves, how to take care of each other. So if we can have the next slide, let's talk about a few of these ways. So how do we deal with anger? Okay? Because irritability leads to anger. That could be a picture of myself screaming at my computer when the email doesn't come up properly and you're stressed and you've had it and you're ready to take a break. So deep breathing is one of the best strategies that we can use to lower our anger almost immediately. This is not breathing from your chest. What you have to do, this is breathing from your stomach and your diaphragm. What I tell people to do is put one hand on their chest, one hand on their stomach, and take several deep breaths. You want to feel your stomach move in and out. This is getting a lot more oxygen into your lungs. It will create a relaxation response within your body and help you fight that fight or flight mechanism that's going on when you're trying to deal with this. Another thing that we use is what we call brisk and problem solving. So the idea is take a break, okay? If you're getting angry, walk away. You're not walking away forever. You're walking away to take some deep breaths, to sort of help yourself get your comfort level back, and then you can go about doing these things like reevaluating, identifying, and solving the problem. Problem-solving skills involve brainstorming as many strategies as you can for dealing with the situation, thinking about what are the positives and negatives of each one, and then choosing one to implement. But again, what you want to do is stop that immediate negative reaction, walk away, take some deep breaths, and then go about trying to find and solve the problem that you might have in that situation. Okay. Anger leads to a lot of problems that can really break relationships and lead to emotional social isolation, if not necessarily physical isolation. It's hard to come back after you've called somebody names and screamed at them. So, oh boy, sleep. Sleep is the first biological signal that our body gives us that we're stressed. So if we're having trouble sleeping, that's our body's signal that things are not right and we've got to do something about it. There are all different types of sleep problems. Problems falling asleep, problems staying asleep, nightmares, panic attacks in your sleep, feeling exhausted even when you've thought you've slept. Okay, I'll say thought you slept because I want to explain that a little bit more in a minute. But this idea that your body is telling you you're stressed, you need to listen to it. You need to accept that you're stressed, and then you can do something about it. So nightmares are common after significant traumatic events such as combat PTSD, sexual violence, terroristic attacks. I haven't heard of people actually having nightmares from COVID, but it may just be that I haven't heard that yet. But these things are all important. Next slide, please. So how do you get your sleep back? We call it sleep hygiene because it involves some simple rules. One is maintaining a regular sleep schedule. Even though we think we can, you can't catch up on sleep. So you can't get less sleep during the week and then say, oh, I'll catch up on it on the weekend. Your body's clock doesn't work that way. You may think you're helping it, but you're not doing a very good job. So maintaining a regular sleep schedule, getting into bed the same time every night, getting up in the morning, even if you're still tired, to get yourself on a regular circadian rhythm sleep schedule. Try to avoid naps if possible. And I know we all fought taking naps when we were kids, and now we all are desperate for the time when we can take a nap. But if you have to take a nap, no more than 15 minutes. Again, we need to get the circadian rhythm back in place, because that's what's the problem when we're having these sleep problems. Don't stay in bed awake for more than 15 minutes. And what I mean by that is, if you're having trouble going to sleep, you're laying in bed, you've been in bed for 15 minutes, and you're still awake, get out of bed. Staying in bed longer is only conditioning you to staying awake when you're sleeping. So what we want to do is make sleep a place, or make your bed a place for sleep. So you don't want to be in there lying awake. You're confusing your body about what is the purpose of laying on that nice, comfortable mattress. Get up, move around, read a good book, sitting up in a different part of your house, and then when you feel sleepy, go back and try again. Don't watch TV or read in bed. The little devices that we all have, like the one we're all staring into right now, are really one of the worst things for sleep. They emit a blue light spectrum. That blue light spectrum tells our body, wake up. Blue light is associated in the circadian rhythm with being awake. So you're trying to go to sleep by watching TV or by reading something on your iPad or your computer, and at the same time you're trying to go to sleep, that blue light is getting into your eyes and into your brain saying, wake up, wake up, wake up. So if you're having trouble sleeping, stop reading the Kindle or the iBooks in bed, and don't watch TV. No caffeinated drinks within 3 hours. This is one that people often don't pay much attention to, but it does make a difference. You should exercise regularly, of course, because that reduces your stress, but at least 3 hours before bedtime. So you haven't, your blood pressure's not pumping, your heart rate's not up, you're not feeling more alert. Don't want to do that right before you're trying to go to sleep. And then have a comfortable bedroom. The best temperature for sleeping is actually between 63 and 68 degrees Fahrenheit. So a lot of us just have our bedrooms too warm to be able to sleep most comfortably. So those are some tips that can really help you deal with sleep problems that come about as a result of the social isolation and the condition we're all in now. If I can have the next slide, please. I have to go a little bit faster because we're running out of time. Oh, sleep and alcohol. If we could have the next, yeah. Okay, so alcohol is not a sleeping aid. It doesn't really matter. I've tried it myself many times on a red-eye flight from California. I'll just drink some wine and then I'll fall asleep. Too much alcohol makes you pass out. That's not sleeping. Next part, please. Alcohol interrupts your circadian rhythm, okay? You may think you fall asleep quickly, but you're waking up in the middle of the night. You're not rested because you're not actually sleeping. Next part, please. Alcohol blocks REM sleep. REM sleep is really important because when you're dreaming, that's the most restorative sleep that you get. So if you are not having REM sleep and you're not dreaming because you've drunk too much alcohol, you're going to wake up feeling groggy. Okay, so this is something particularly we find with men, and particularly we find this has been a problem with our veterans that we treat for post-traumatic stress disorder, is unfortunately because of their stress, they're getting 2 to 3 hours of sleep a night. So then they decide, well, they'll just drink a lot of alcohol and fall asleep. And now they've created an even more difficult problem. So again, alcohol also means more trips to the bathroom because it's a diuretic. You're going to need to empty your bladder more often. That means you're going to be up more and you're not going to be sleeping. Okay, next slide, please. So how do you know when it's a problem? Okay, you're drinking to improve your mood. You're drinking specifically to improve your bad mood. You're making bad choices. You're drinking enough to cause problems. You're showing up late or missing work, and social events center around drinking. Again, things that we don't want to do, particularly the first one, drinking to get rid of the stress we feel right now, drinking specifically to change our mood. It's just going to make it worse. It's not going to help you deal with the isolation. These are just some things that you can do. If you feel you have a problem, I put these in here because I want to be able to provide some things for people to do if they think this is a problem for them, or think they might be heading down this road. As I said in the previous slide, alcohol abuse is increasing because of this stressor. So, try and get away from the situations, find out what these stress triggers are, exercise, do better, get better sleep, and confiding in a friend. These can all be important things to help you deal with any particular alcohol use you may be having right now that may be interfering or getting on that thing. So just to kind of sum up how we're dealing with the emotional isolation, at Restores, we know that some people will recover without treatment, and I highly recommend the Calm app. I wish I'd thought of it myself, but it's a really good app. If you don't have it on your phone, it was free for a while. I think parts of it are still free, but I would highly recommend that you download it. It will help you pace your breathing and learn to take deep breaths. It also has wonderful, what they call sleep stories, which you can turn your phone upside down so you don't get the light. They are very calming stories that they've actually done some studies that have been shown to help people get to sleep. A second thing that is available is something we're doing at Restores, which we call single session consultations. We started them for medical personnel, for first responders, but we've been getting calls from more groups, teachers, journalists, all of whom want to know if they could participate. We think about these things as people are resilient for the most part, and unfortunately, in all of this stress, they've lost the ability to be resilient. And so we do single session consultations with one of our licensed mental health counselors. It is not therapy. It is also free right now, but it is a single session meeting that one can have where you can talk to a mental health professional, talk about the stresses that you're undergoing right now, talk about your resilience, come up with some goals and an individualized treatment plan an individualized plan that you can use to help you get back on track and achieve the goals that you set. We've been finding we give you a call 2 weeks later after this session to make sure everything's going okay. Most people have found this to be helpful in dealing with a particular stressor that they're having at this moment. And then, of course, for people who need more, almost all mental health professionals right now are offering telehealth experiences for people who have the more severe symptoms and who are in need of more than just a single session. So I think that's my last slide. I wanted to leave some time for questions. So thank you very much for your attention, and please always feel free to reach out to me if you have a specific question I might be able to help.
Thank you, Dr. Beidel. That was a lot of very relevant information, a lot to unpack, a lot to think about. We do have a question here from Catherine. She says she's finding it really hard to share these coping techniques with older or elderly parents. They're scared about the news they hear on TV. As their child, they are less reluctant to listen to me when I try to share these wonderful ideas. What else can I do?
So sometimes the information has to come from someone their same age. So if my family doesn't think I know anything about mental health because I'm in their family. So I think that sometimes it has to come from someone else. So if there's another relevant person in their life who might be able to provide that same information, whether that is a physician or a someone from the church or a clergy in some way, another way of providing them with the information, that would be one way to help them get it and use it. The other thing is to offer to do some of these things with them. So just as with children, we often have parents engage in the relaxation or whatever we're doing at the same time. Offering to do these skills with them will often get them to try, and once they have some initial benefits, then they'll be able to keep doing it on their own. So if they don't want to deep breathe, tell them about putting a hand on their chest and one on their stomach and doing it with them so they can have some instructions and some feeling of engagement. Even if they're just humoring you at the beginning, it will get them along the right path.
For those in the industry who may not have insurance because they're furloughed or laid off right now, are there free resources for them to get some assistance through therapeutic sessions?
Yes, there are. We, like I said, we are offering the single session consultations at no charge by calling UCF Restores. Another good resource is the Mental Health Association of Central Florida. I know that they have some funding and lots of resources for people who might be able to do some sessions at no charge. Most therapists can set aside a portion of their work, what we call pro bono, to offer sessions at no cost. So they would be a good person to call. You can also call Restores. Our clinical care coordinator has a wonderful list of resources that are available, and we can certainly help out. There's funding right now for people to provide services at no cost, so we're happy to hook people up.
There's a question from Moses. Moses says, I have a brother who's in the military, and he tells me that he doesn't want to use apps to help him breathe or meditate because he doesn't want to be dependent on apps. Is there research on whether or not people can end up being dependent on such apps?
Not right now. The idea of the apps is to teach people skills. And what we know about is if people gain the skill, then they should no longer need the app. It's kind of like training wheels, right? So when you first start to ride a bike, you've got those extra wheels on the side until you learn how to balance and how to ride the bicycle. Then the training wheels come off. Apps are the same thing. Now, for some people, though, apps alone are not effective. Again, we do at UCF Restores, we do a lot of our treatment using virtual reality. But virtual reality is not a treatment. It makes our treatments better. And that's what I tell people about apps. For some people who are just having some stress, some temporary stress, learning how to breathe deeply might be very good and might be all they need. But for people who have had significant trauma, particularly those in the military, combat post-traumatic stress disorder is a much harder nut to crack than even civilian post-traumatic stress disorder. So for some people, just the app is not sufficient. They really need a more comprehensive treatment program of which apps might be a part.
Okay. We have a question about the hospitality industry. During normal times, the industry is plagued with high alcohol and substance abuse. And the statistics presented here during COVID make Cynthia very concerned that this is a tendency in the industry. For those who are still working, what is an appropriate way that supervisors and managers can offer help for their employees or can offer help to their employees who may be laid off or furloughed?
So I think if we're talking specifically about alcohol abuse or even in general, I think one of the really best things that supervisors or employers can do is, first of all, to acknowledge that this is a stressful time, okay, and that people may be behaving in ways that are somewhat unusual because it's a really stressful time. The second thing I think is really important is for supervisors and employers to be open about wanting to help people get help, right? And I think it's more than just saying call EAP. It's a bigger conversation that involves, look, this is really hard on everyone. There may be a time when you need to go and get some help. And as a supervisor, maybe I don't even need to know what the problem is. I just may need to know that you need, to reach out to someone. And so I think providing that level of comfort by making people understand that it is not a personality weakness that they have, that this is an event that's causing a stressful emotional reaction, and that the problem does not lie in the person who just needs to pull themselves up by their bootstraps, or who needs to just get over it. What we hear from the first responders all the time is that they're so tired of hearing, "Suck it up, buttercup. You knew what the job was like." No. No one should experience having to pull drowned and dead kids out of the water. The other thing is, with the industry and the hospitality industry, no one expected that this would go on this long. This is highly unusual. The more employers and supervisors can be supportive and say, look, maybe it's time to talk to someone, or, look at it and talk about it in terms of their work functioning. You were always prompt. Now you're coming in really late. Okay, you always got all your work done. Now you're not getting your work done. I'm worried that you're really having a reaction to this stress. Would you like to talk to EAP, or do you have the resources that you need? Or I heard about this very good place, and I'm not advertising Restores because we don't take insurance. All of our treatments provided at no cost. But even I heard about this place called the Mental Health Association of Central Florida. If you're having trouble, they sound like a good place. They might be able to help. And I think having the attitude that this is normal, that stress and the reactions are normal in this very abnormal time, is going to be the best thing that you can do to help your employees.
Okay, we have time for one last question. This person says that they might have missed it in the presentation, but did you talk about nutrition or recommended good food to help our brains absorb stress better?
I'm not a nutritionist, so I won't recommend specific food, but you make a good point in that we do know, just from using the food pyramid, healthy grains, vegetables, fruits, all of those things. But you do bring up an important point, because during periods of stress, sometimes people don't feel like they can eat, they're not hungry. It's important to eat even small amounts, maybe more frequently during times of stress. So not to necessarily have 3 big meals if you can't eat, or you feel like you're just not hungry, but to eat smaller, healthy amounts of food during the day will help keep your energy level up, will help keep your brain functioning at its peak performance. So thank you, that's a good point.
Well, thank you. That's all the time we have for questions today. Thank you so much, Dr. Beidel. Thank you so much, Dr. Horan. There will be another Research Recovery and Reskill webinar on October 8th, the second part of this 4-part series on people working or not working in isolation. And it will be managing emotions and stress during COVID-19. Keep in mind, attendees, that there will be a post-event survey coming your way, so please do take some time to fill that out. Please visit the Rosen College website and click on Professional Development in the Academics drop-down menu at the top of the homepage to find complete lists of information on the Research Recovery and Reskill webinars. This was a very important webinar for the hospitality industry and for any industry at this point in time. A lot of very, very deep information here, so we hope that you will continue to join us. We have 7 webinars in the fall series on Thursdays through November 12th, so please do continue to join us. You can see the webinar information on the screen, and also keep in mind we do have some degree programs that those of you who are looking to advance your skills, if you're working or not working, may want to take advantage of. Thank you all for joining us today, and have a great rest of your day.